Hi, this is Andrea Kane, and I am here with HSC 114 Medical Terminology, where we are learning about the language of medicine, 12th edition from Davy Ellen Chabner. We are now on week 11, and that means chapter 15, the musculoskeletal system. So if you are looking at your syllabus, we are doing unit objectives 9.11.1 through 9.11.10 this week. And we are also defining terms relating to the structure, function of bones, joints, and muscles, as well as ligaments and tendons. We will be talking about the process of bone formation and how bone grows. We will be going over the major bones of the body. We will talk about combining forms, prefixes, and suffixes, as always, specifically as they focus on the musculoskeletal system. We will talk about the things that can go wrong with our muscles, joints, bones, tendons, ligaments, those types of things, and terms that are related to bone fractures. We will talk about the handful of lab tests that are used with this body system, but mostly the clinical procedures. There's quite a few of those. We'll cover the relevant abbreviations and make sure that we can talk about the medical terms in proper context. All right, so let's move forward. Your musculoskeletal system is made up of bones, muscles, joints, as well as ligaments and tendons. All right, so what are your bones? They are your structural support and they protect internal organs. Your muscles permit or promote internal and external movement. Your joints are where the bones come together and have flexibility. Your tendons bind muscles to bones. Your ligaments bind bones to other bones. So you need to know this. Make sure that you, on this slide, that you're especially focusing on the definition of bones, muscles, joints, tendons, and ligaments, because you will need to know ligaments are bone to bone, tendons are muscles to bone, and your joints are where they all come together. All right. Some physicians that are associated with the musculoskeletal system. You've probably already heard of orthopedic physicians or orthopedists or orthopods. They're all names of medical doctors, MDs. You may have heard of osteopathic physicians, doctor of osteopathy. They are just as good as MDs. In their training, they focus on a procedure called manipulation, where they're making sure that the spine is in alignment because they believe that that has an impact on health. Physiatrists work primarily in the inpatient and outpatient rehab field, helping patients come back from injuries or disease or other kinds of illnesses that have impacted their musculoskeletal system. And then you may have heard of rheumatologists. Those look at particularly patients with autoimmune type musculoskeletal illnesses, like rheumatoid arthritis or lupus. They're looking at that. So that's how those are all involved. How do bones form? It is called the process of ossification, and it's where cartilage is replaced with bone. It makes those bones nice and strong. You have three types of bone cells. You have osteoblasts, osteocytes, and osteoclasts. Osteoblasts produce immature bony tissue that replaces the cartilage. Osteocytes nourish and maintain bone, and osteoclasts reabsorb or digest bone. They remodel it or they remove it. So osteoblasts and osteoclasts work together. One deposits bone cells, the other one tears down bone throughout life. Your skeleton is a source of calcium. Proper formation of bone depends on calcium, phosphorus, and vitamin D. We talked a little bit about that last week in the endocrine chapter. Calcium phosphate enzyme helps create hard bone from these sources. And again, your body is a reservoir for calcium storage. You have calcium in your bloodstream as well as in your bones. Calcium is necessary for nerve transmittal to muscle. It has to have that to be able to move that message along, including your heart muscle and muscles that are attached to bones. Your calcium level is maintained in the blood by your parathyroid gland. Remember, we talked about that last week. That secretes a hormone to release calcium from the bones. So when when your blood calcium level is low, it secretes a hormone that releases the calcium from the bone and increases that blood calcium level. You also have a hormone that secretes that moves the calcium out of the blood and back into the bone. So you have those two processes going on. All right, so bone structure. Bones are long, short, flat, or sesamoid in shape. They have a shaft called a diaphysis, an end called an epiphysis, or a cone-like flared portion between the end and the shaft called a metaphysis. So diaphysis, epiphysis, metaphysis. And you have an epiphyseal line or growth plate where the cartilage is replaced by bone for bone growth. And that's in terms of the length of the bone. I think we have, in a couple more slides, we'll have a visual for you on that. Your interior bone structure includes articular cartilage, the epiphyseal line or growth plate, cancellous bone, compact or cortical bone, a medullary cavity, and periosteum. So let's see. This is what it looks like. If you are looking here, we're going to start on the left. The diaphysis is the shaft of the bone. It's the long portion. The metaphysis is the piece where it's starting to move out toward the end. It's this larger piece where it's going from narrow to wide. And in that, between the metaphysis and the epiphysis, that's where you have the epiphyseal line. The epiphyseal line. That's where that is. That's your growth plate, that blue line there. Your epiphysis is the end of your bone. That's where it has those articulation points. All right, so that's what you have, and that's the same in the other. This type of bone here is called cancellous, and we'll look at the cross section in a minute. And then you have the compact bone, you've got the medullary cavity, and then you've got the periosteum covering. So you've got all these things going on. But okay, so the diaphysis is the shaft, the metaphysis is the area where it goes from narrow to wide, and then the epiphysis is the very end. And in between the epiphysis and the metaphysis is that epiphyseal line or growth plate. So make sure you're aware of this. All right, if we look at that cross section, on the outside is the periosteum. That is that outer covering of the bone. Inside that, you have the compact bone area. This compact bone area has nerves and blood vessels and all sorts of stuff in it. And then you get into the cancellous or the spongier trabecular bone, and that's in the middle. This cancellous part is where all the red bone marrow is. And there are also blood vessels in there. But this yellow part has yellow bone marrow, which is made up of fat. So make sure that you're familiar with all of those. So we talked about the ends of bones covered by articular cartilage in the joint to cushion the joint, allow it to move smoothly. You may have heard of people who have bone on bone in their joint because that cartilage has been worn away or damaged in some way, and their joint is no longer cushioned and they have a lot of pain, so they've got to have a joint replacement. That's what it's talking about. That articular cartilage cushions that joint, along with the synovial cavity and synovial fluid and all that, but the cartilage is there. So we talked about compact bone that has the Haversian systems for blood vessels, nerves, and yellow bone marrow made up mostly of fat. Then you have the cancellous bone or spongy trabecular. That space contains red bone marrow with elements for blood formation. That's where you have the blood cells being formed. So your yellow marrow is made up chiefly of fat. Your red bone marrow, though, is rich with blood vessels and immature and mature blood cells in various stages of development. In later life, as you get older, it may be replaced with yellow marrow. Hematopoiesis or hematopoiesis is the production of all types of blood cells that happens in this red bone marrow. So we've talked about erythropoiesis before. That's red blood cells. This specifically is talking about hematopoiesis, which is all types of blood cells being produced in this red bone marrow. All right, on your bone, you have processes and depressions. Your processes or processes, those are your attachment points where muscles, tendons, and ligaments hook into. They usually are protrusions, so to speak. Depressions, on the other hand, are openings or hollow regions that help join bones or serve as passageways for nerves or blood vessels. So you have processes, which are the parts of the bone that stick out, or you have depressions. So let's take a look at some processes and depressions. You can see right away over here on the bone head on the left, that is an articulation or a process. It sticks out, and same thing here with the trochanters. They stick out for things to attach to them. Yet the bone neck is a depression. It allows those vessels and things to move through there without getting crushed. And you see the same thing at the bottom of this femur. And then again, on the other side, the humerus. This is an upper arm bone. And you can see here at the shoulder point where you've got the bone head and a tuberosity to attach to. And then you've got the fossa down here at the elbow area where you've got room for those blood vessels and nerves to come down into that elbow area to then move down into the arm bones. All right, cranial bones. These are just the major cranial bones that you'll see. Anterior, remember, is the front of the skull, and posterior is the back. And the foramen magnum is where the entry for the spinal cord to head down into the spine. So that should kind of give you an idea of what we're looking at. Another view from the side, and you can see again the different bones, and you can see the sutures that are between the bones. Those sutures are actually immovable joints. And I think we'll talk about that a little bit later, but you can see those. You can see that you have some processes down here. You have a mastoid process and a styloid process. That's where some muscles, bones, tendons, muscles, tendons, and ligaments will hook up to keep things attached. And you have a depression here in your eye. Why do you have a depression in your eye? You have things to go in it or things to move through it. All right. So moving on, this again just lists them: frontal bone, parietal bone, temporomandibular joint, which is your TMJ, mastoid process, styloid process, occipital bone, foramen magnum, sphenoid bone, sella turcica, ethmoid bone. And then this is from the front, looking straight at the front to the back. And this again shows you a suture, which is a joint that does not move. Whenever you see suture, when it has to do with bones, it is a joint that does not move. It is immovable. It's permanent, so to speak. It's in one space and it won't move. And then you've got these bones that it goes over again. And you think about the zygomatic bones and how there's a protrusion here or a process, and how there are muscles, ligaments, and tendons that happen and move to be able to move the jaw here. So facial bones, you have nasal bones, lacrimal bones, maxillary bones, mandibular bones, zygomatic bones, and a vomer. So let's talk about sinuses. You have air cavities located in facial and cranial bone that lighten the skull, make it so it's not so heavy because there's a lot of bone in your skull. And then they warm and moisten the air as it passes into the respiratory system. So you can see how if they're warming and moistening the air for the respiratory system, how sometimes your sinuses can get infected when they pull in the air. All right, moving on to your vertebral column and the vertebrae. If you'll notice, you have different segments that they're going to talk about. You have a cervical segment with 7 vertebrae in it, and that's your neck area. Then you have 12 thoracic vertebrae, starting here and moving down. That is mostly your chest area. Then you have lumbar vertebrae. You have 5 of those, and that's considered your lower back or abdominal area. And then at the very bottom, you have one big bone called the sacrum and a little section there called the coccyx, or your tailbone. And so those together are your sacral area. Okay, you have 26 bone segments. We just looked at that in 5 divisions, separated by pads of cartilage called intervertebral discs. Those are in between. They don't show them here, but they're actually in between the vertebrae, and they cushion. And so we talked about all of that. Moving on, bones in your thorax include your clavicle, scapula, sternum, and ribs. In terms of your pelvis, it includes your pelvic girdle, ilium, ischium, and pubis. For hand and arm, humerus, ulna, radius, carpals, metacarpals, and phalanges. Yes, your fingers are considered phalanges. And strangely enough, so are your toes. On this next visual, you see your phalanges also mean toes, fingers and toes. It's the type of bone that they are. In your foot, we'll start here on the picture on the right. You have distal phalanges, middle phalanges, proximal phalanges, which makes sense. Your distal is the furthest away. Middle is middle. Proximal is closest. Then you have metatarsals, and then you have tarsals. And included in your tarsal area is a talus bone and a calcaneus bone. So you may hear of those specifically named. And then this is a view from the side of your tarsals, which includes your talus and your calcaneus, and your calcaneus is considered your heel. And then your metatarsals, which is midfoot, and then your phalanges. All right, so looking at leg, foot, and associated structures, you have your femur and the acetabulum, patella, tibia, which also includes the medial malleolus, fibula, lateral malleolus and talus, tarsals, calcaneus, talus, metatarsals, and phalanges. And I'm going to refer you back to your book. I was looking at this with a different class earlier, so make sure you take a look at your book because it has all of the pictures, but it also has some additional ones that you may find helpful. All right, so in terms of vocabulary, when we're talking about bones, acetabulum, acromion, bone, bone depression, bone process, calcium, cancellous bone, cartilage, collagen, compact bone, cranial bones, diaphysis, disc, epiphyseal plate, epiphysis, sorry, excuse me. Epiphysis, facial bones, fontanelle, foramen magnum, Haversian canals, ligament, malleolus, manubrium, mastoid process, medullary cavity, metaphysis, olecranon, orthopedist, osseous tissue, ossification, osteoblast, osteoclast, periosteum, phosphorus, physiatrist, pubic symphysis, red bone marrow, ribs. And it talks here about ribs that you have true ribs for the first 7 pairs, false ribs are pairs 8 through 10, and floating ribs are pairs 11 and 12. Take a look at your book. It may explain that a little bit further about why they call them true, false, and floating. Sella turcica, sinus, styloid process, suture, temporomandibular joint, TMJ, tendon, trabeculae, vertebra, xiphoid process, yellow bone marrow. The knuckle-like process at the end of a bone near the joint it's not a fossa because that's a depression. It's not the diaphysis because that's the shaft of the bone. The question is it a condyle or tubercle? And I'm going to leave that up to you to look it up. I know the answer, but I'm not going to give it away. All right, the process of bone formation is not olecranon, because that has to do with your elbow. It's not your xiphoid process, because that's at the bottom of your sternum. So is it ossification or osteoblast? Look it up if you're not sure. All right, combining forms. Remember our equation. It is the root plus the combining vowel to equal our combining form. We have calso and calcio. Watch out for those two right there for calcium. Kypho, lamino, lordo, and lumbo. Myelo, ortho, osteo, scolio, spondylo, vertebro. Now suffixes. Last, clast, lithesis, malacia, physis, porosis, tome. More combining forms. Acetabulo, calcaneo, carpo, claviculo, costo, cranio. Femoro, fibulo, humero, ilio, ischio, malleolar, malleolo. Mandibulo, maxillo, metacarpo, metatarso, olecrano, patello, pelvi. Watch out there. There's an I there for pelvi. So make sure you make a note of that. Peroneo. Peroneo means fibula. It has nothing to do with the abdomen or the peritoneum or perineum or anything like that. Peroneo is fibula. So make sure that you make a note of that, because that would be an easy one to confuse. Phalango, pubo, radio, scapulo, sterno, tarso, tibio, ulno. All right, now we get into what in the world can go wrong with bones. Well, the first thing out of the gate here, you'll notice there's a couple of sarcomas, and those are malignant bone tumors. Or malignant tumors arising from the bone. So unfortunately, cancer is very much something that can happen to pretty much every body system. Exostosis is a bony growth on the surface of the bone. For whatever reason, on the surface of the bone, a bony growth decides to grow. And that is that one. Osteomalacia is when the bone decides to soften. There's a lot of causes for that, and that can really affect people and cause problems. Osteomyelitis, you may have heard about that, where someone has an infection of the bone that has caused inflammation. That's osteomyelitis. Tallops is a congenital, or it's an anomaly that a child is born with. It used to be called club foot. It's now called tallops, and that's where their talus is born abnormally formed. And yes, there is surgery to fix that. All right, so what can happen when you fracture a bone? Well, best case scenario, if you're going to fracture a bone, best case is this simple fracture or closed fracture, where the fracture is there, but the bone has not moved. That is best case scenario. So if you're going to get a fracture, that's the one to aim for, okay? All right, a very bad one is a compound fracture. That's where the bone has not only broken, but it's displaced so far it's broken through the skin, protruding through the skin. That is very, very dangerous and very serious. That is like an immediate surgery situation. All right, so some other things that can affect different specific parts of the body. You may hear of a collis fracture. That is a wrist fracture. It's always in the wrist. And it's where the bone is not only broken, but it's moved a bit. It's displaced a bit. It's not through the skin, but it's displaced just a little bit. You may have heard of compression fractures. That's where a vertebrae basically just crumbles, either in part or in the whole. And sometimes that you may have heard of a pathologic compression fracture, where it just happens. Nobody knows why. An elderly person may be sitting in a recliner and it happens. And their bone just simply disintegrates. Compression fractures can also happen due to trauma. If there's enough pressure on the vertebrae, it can essentially crumble if there's enough force, like in a major automobile accident or a motorcycle accident, those types of major trauma. Same thing when it comes to your femur. with either a comminuted fracture or a green stick fracture. A comminuted means basically you've got all sorts of bits and pieces here and you're missing the middle part. A green stick fracture, notice that there's these mini hairline fractures that go deep into the bone. That yes, the bone may not have broken completely, but there's enough of it that you've got these hairline fractures going up on the side, and there's an issue where you may have some missing bone pieces. It's not all the way broken through like the comminuted, which is completely in pieces in two different parts. This, you've still got some of it together, but you've got these hairline fractures that you're going to have to deal with. And so that's the different types. All right, joints. Joints are also known as points of articulation. It's a coming together of two or more bones. You have two types of joints. One is called suture joints. Those are removable, and those are all in your skull. You also have synovial joints. That's pretty much everything outside of your skull. That is wherever the joints are freely movable. And you have different types of freely movable synovial joints. You have ball and socket in your hip and shoulder. You have hinge when you're talking about elbow, knee, and ankle. And those are very different, but yet they're all synovial joints. They all have a synovial cavity. They all have synovial fluid, and they all involve cartilage and bone and ligaments. All right, so let's go into it. Synovial joints. You have a joint capsule that surrounds the bone. The ligaments band the bones together. The bones are covered by articular cartilage, and that's in between those to, again, cushion that. You have a synovial membrane that lies underneath the capsule and lines the synovial cavity, which is filled with synovial fluid. So I'm going to show you a visual of this in another slide or two. But in the meantime, when it comes to your knee, so mentally draw a line here, right here. Draw a line in your mind. This is all about your knee. You have a meniscus in your knee. It's a crescent-shaped fibrocartilaginous structure that divides the joint cavity. That should be joint. There's a missing T right there. And it acts as a protective cushion. It's only present in your knee. So this is sort of extra information. I wish they would have put a line there for us to kind of mentally change subjects. Bursa, bursae. Closed sacs of synovial fluid with a synovial membrane located near but not within a joint. They're needed when sliding must take place. Common sites between tendons and bones, between ligaments and bones, and between skin and bones when you have a prominent bony part of anatomy like your elbow or your ankle. All right, so this gives us the knee joint right here. And how can I tell you that? Well, we've got that nice little meniscus there that gives it away. And also we're talking about your tibia. All right, so, oh, and here it talks about how your meniscus is there. Alrighty there. So here you've got this area right here, and I don't even know what color to call that. But that is your joint cavity, and you've got synovial fluid inside of there. And notice you've got a little bursa here as well. But anyway, the blue around the bone is your cartilage. And so you've got that fluid and the cartilage to help, as well as the meniscus in this particular joint, to help things move together well. And then, so you've got another bursa up here. And then over here, this just shows you the ligaments, how the ligaments are attaching in there. And how you've got them on the side here as well. All right, some terms. Articular cartilage, articulation, bursa and bursae, watch out for that plural, ligament, meniscus, suture joint, synovial cavity, synovial fluid, synovial joint, synovial membrane, I almost said synovial tendon, but no, just tendon there, just tendon. All right, the fibrous connective band that binds muscles to bones is what? What binds muscles to bones? Whoops, I went ahead a little bit too far, didn't I? All right, if you're not sure what that is, look it up. Hint, 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 it's not synovial membrane, and it's not articulation. But you need to know the difference between ligaments and tendons and what they do. Please make sure you study that. All right, combining forms. Remember our equation. A root plus a combining vowel equals the combining form. So we have ankylo, arthro, articulo. Ooh, we're missing an O there. Articulo, burso, and chondro. Ligamento, rheumato, synovo, teno, and tendino. Oh, we've got 2 for tendon, so watch out for that. Teno and tendino. Now, desis and stenosis. Those should have been suffixes. Their editing is a little off today, isn't it? This should have said suffixes. Desis and stenosis. All right, what can go wrong with joints? Well, one of the biggest things that goes wrong with joints is arthritis. Has anyone ever heard of arthritis? The most common type that you hear about is osteoarthritis. That's the third one down here, osteoarthritis. It's a loss of articular cartilage and formation of bone spurs at articular surfaces. Can occur in any joint, but mainly in spine, hips, and knees of older people. It's just a part of normal aging, especially if you've lived a busy, active, crazy life. So osteoarthritis, make sure you're familiar with that. Another type is rheumatoid arthritis. That is where your body has decided that the joint tissues are the enemy and has begun to attack those. And so you have that type of arthritis, which is terribly painful and debilitating, and it really won't stop until it destroys the joint. Gouty arthritis is another one. If you've ever heard of someone with gout, they have excessive uric acid in their body. This mainly affects their feet, ankles, their foot essentially, their toes, foot, ankle areas. And one of the ways that people with gout can keep it under control is to drink lots of cherry juice. Sometimes they can keep it in check without medication if they drink enough cherry juice every day. And sometimes they use that in addition to medication as a benefit as well. Then the last type they bring up here is ankylosing spondylitis. And this is a chronic progressive stiffening of joints, mostly in the spine. So you'll hear about it if you're working with spinal orthopedists with ankylosing spondylitis. All right. Oh, good. They give us a visual of this. Okay, so on the left is a normal joint. And it shows us, if you're looking at it, up here you can see the blue between the bones. That's the cartilage. And then you've got the joint capsule and the synovial membrane, and this white area is the synovial fluid. And so that's what it looks like if it's normal. You've got the bone, you've got the cartilage, you've got the space in between with the fluid. If it's not normal, if you've developed osteoarthritis, look at that. There's hardly any cartilage left. It's been worn away. You might have these bone cysts. You might have developed bone spurs. Your bone has thickened in some places. See, you've got like this little spurs over here on the side, and it's just not a good situation there. Rheumatoid arthritis is even worse, unfortunately, because not only has that reaction, that autoimmune reaction, gone in there and attacked the synovial membrane and caused inflammation, but it's eroded the cartilage, it's taken out most of that fluid, it's caused this fibrous ankylosis and bony ankylosis, it's caused bone atrophy. You look at the difference, it's horrific. You've got all that, plus you've got the inflammation around it. So that visual helps you see the difference between the three. All right, what else can go wrong with joints? Well, there's something called a bunion, where you can have a swelling in the joint between the big toe and first metatarsal bone. And that can sometimes be dealt with surgery. Carpal tunnel syndrome. Most anyone who's used a keyboard has heard about this. It's where your median nerve between your wrist and your hand gets compressed, and they have to do a carpal tunnel release, which is where they go in and they widen that space back out so that that nerve is not so compressed. And then you can dislocate a joint. If you've ever heard of someone with a dislocated shoulder where it's come out of place and it had to be put back in, it's very, very painful. And unfortunately, once you dislocate a joint like that, whether that be a hip or a shoulder, it tends to get dislocated again more easily the next time. There are things that they can do to try and keep it in place, but it may eventually turn into a situation where you have to have the joint replaced because of the frequent dislocations. I've seen that in the past. All right, so this is a visual looking at carpal tunnel syndrome. Here, starting on the left, you can see you've got that median nerve coming up from the wrist into the hand, and where it gets compressed there, you've got it right over here. There's the nerve. You've got the ligament, the tendons, and you've got the bones. And you can see how, as these things are all moving, that nerve can get compressed over time, and how they would need to go in and do some kind of release so that that nerve is not being pressed on so hard. Other things are ganglions. That's a cyst. That means it's a fluid-filled sac that arises from the joint capsule or a tendon in the wrist, and that has to be dealt with. Herniation of an intervertebral disc. Have you ever heard of the term slip disc? That's where a disc has protruded. It has moved. It's no longer staying where it should be, and it's actually pressing on or against spinal nerves or into the neural canal, and has to be dealt with usually through surgery. And then Lyme disease is considered a joint disease, and that's because it causes recurrent arthritis, myalgia, malaise, neurologic and cardiac symptoms, and it's caused by a tick bite. So if you are out and about, make sure you are very careful when it comes to this, because Lyme disease can have effects. They're seeing it now. It can affect a person for 20 years or more, 20 or 30 years with symptoms, and sometimes they can be progressive. All right, so other things can happen with a joint. There can be a sprain where you have trauma to the joint with pain, swelling, and injury to the ligaments. That's a ligament sprain, but thankfully they didn't rupture. Because if they rupture, that's going to be surgery right there. If they rip or tear or are ruptured, you're going to be facing surgery. All right, lupus is also considered a joint disease. It is a chronic inflammatory disease. They're not sure if it's autoimmune or what have you, but it involves the joint, skin, kidneys, nervous system, heart and lungs, collagen in the tendons, ligaments, bones, and cartilage all over the body. And again, lupus is another one of those that can progress and can be around for a very, very long time. All right, muscles. We're on to muscles. All right, you have 3 types of muscles, and I'm going to pick on cardiac first because that's the easiest. So cardiac muscles are not consciously controlled, and they're found exclusively in the heart. They have that specific type of muscle tissue, and it's only in the heart. Then you have smooth muscles. Smooth muscles control your internal organs. So their control is involuntary. They don't get to say, yes, I want to move, or no, I don't. They are just they're involuntary. They just move because they move. They have to. And they have a type of tissue for that. Then you have striated muscles. Those are the ones under voluntary control. Those are the ones that are sent messages to do things. They move the muscles as well as the face and the eyes. So let's take a look at those tissues. The first tissue they have here on the left is striated muscle, and then they have smooth muscle, and then the bottom is cardiac muscle. So you can see kind of the differences between the fibers and how form follows function. They're made to do different things. You can't use striated muscle for the heart, and you can't use cardiac muscle for smooth muscle. And this is a good visual. It just gives you an idea of what the muscles do, where they're located and what they do. And pretty much where they're located defines what they do. So for instance, the one around your eyes, this orbicularis oculi, that closes your eyelids and wrinkles your forehead. So where it's at often defines what it does. Actions of skeletal muscle, and this is in your book. I would really encourage you to go and look in your book for all of these, but there's another slide that shows you those. They're pretty much opposites in many ways, except for rotation. But if you want to get the real definitions, go to your book. Okay, so rotation, you're thinking your neck. Abduction is away from the middle of your body. Adduction is towards your body, toward your middle of your body. You've got supination, where you're moving it up, pronation, moving moving it down or closer to the body, further away from the body. Supination is leaning outward versus pronation, leaning inward. Flexion, plantar flexion is moving your foot away from your body. And dorsiflexion is moving it toward your body. Extension, you're moving it away from your body. Flexion, you're moving it toward your body, or you're rolling it up versus relaxing it or extending it away, those types of things. So make sure you look at those terms and are familiar with them all. All right, abduction and adduction, dorsiflexion, extension, fascia, flexion, insertion of a muscle, origin of a muscle. Make sure you know the difference between insertion and origin. What do those mean? Plantar flexion, pronation, rotation, skeletal muscle, smooth muscle, striated muscle, supination, visceral muscle. Movement away from the midline of the body. I can tell you right now it's not flexion or dorsiflexion. So it's got to be one of the other two. Take a look at the prefixes. Which one means toward and which one means away, and you'll have your answer. Combining forms, you have fascio and fibro, lyomyo and myo, myocardio, myoso, watch out for that myoso, planto, rhabdomyo, sarco. Now we have suffixes, asthenia and trophy. Prefixes, ab and ad, dorsi and poly. What can go wrong with muscles? Well, one of the biggest things that can go wrong with muscles is muscular dystrophy. That is an inherited disease. Okay, so that's hereditary, or it's something you're born with through genetics. It's a genetic inheritance of progressive muscle weakness and degeneration without nervous system involvement, and typically it'll end in death. Most of these do at some point. Notice it's without nervous system involvement. What that means is they're still receiving nervous impulses and messages and chemicals telling the muscle what to do, but the muscle can't do anything. The muscle, for whatever reason, based on the type of dystrophy it is weak and cannot respond. It can't follow directions. Remember, these are voluntary muscles, and they don't voluntarily. In this case, with this dystrophy, they can't voluntarily follow those instructions. So that's why it falls into a muscular situation. Polymyositis. Polymyositis. That is a chronic inflammatory type of muscle disease. They're not sure yet if it's an autoimmune disorder, but it's pretty much what it says. Your muscles have a chronic inflammatory reaction, and that impedes their ability to function. So lab tests, there's not very many. And if you notice, none of these are really direct muscle type tests, or bone, ligament, or joint. The closest to it has to do with the erythrocyte sedimentation rate, or maybe the rheumatoid factor test, or looking at the serum calcium level, or those types of things, or uric acid tests. They're really looking at things that are around that may be impacting the musculoskeletal system. Where it really gets busy and intense is when it comes to clinical procedures. And a lot of these, you'll notice, have to do with diagnostic imaging or the field of radiology. So you'll see here bone density tests, bone scans, CTs, X-rays, MRIs, PET scans, all those types of things. Arthrocentesis is where they go into a joint and they remove some of the synovial fluid for testing. Arthroscopy is where they put a scope into that joint and they go in and they look around. They may take some tissue samples. They may shave off some cartilage or that type of thing. And then electromyography, that is looking at the electrical impulses moving across a muscle. So abbreviations, there are several pages of abbreviations here, and I wish I could tell you that none of them are really important, but they all are, and almost all are used in the field, so you're going to need to be familiar with most of those. So make sure you go through all of these and are familiar with them. All right, that is it. We have flown through the musculoskeletal system chapter, and that is for week 11. I hope you have a great week. We're supposed to have beautiful weather, so hopefully you can get out and enjoy. Then after that, I think we're supposed to have snow. Next week will be week 12, and we will be talking about chapters 16 and 17, the skin, the eye, and the ear, and senses. We will be talking about senses. So take care. If you need anything, reach out to me, and have a fabulous week. Bye.